One of the innovations of the new version of PocketBilling, version 4.0, is a new coding wizard that assists doctors with the difficult chore of trying to figure out what evaluation and management code to select. We based this on the Center for Medicaid Services official guidelines for coding, trying to make it easier for doctors to perform this task. It allows you to go through either the 1995 guidelines or the 1997 guidelines very easily, either with a specific patient or just running through it to double check some work that you may have done or are planning on doing. To get to the E&M coding wizard, tap on New and then Visits, and you'll have to create a new visit in order to get to this, and then select what type of visit it is, whether it's initial, subsequent, ambulatory, procedures, or more. Let's say you wanted to check an initial visit. You would essentially go to the section up here where it says Generate E&M Code and select whether you want the 1995 or 1997 guidelines. Since many organizations recommend the 1997 guidelines, I'll use the example here, but you can use either one. Select 1997 and whether you want an inpatient code or an outpatient code. I'm going to use an outpatient code because that's where I'm usually in clinic the most. If you have any doubts about it on any of these screens, you can select the question mark and it'll give you some visit type help on the actual code that you've selected. I'm going to go to the office outpatient and select whether it's a new, established, or consult. In this case, most of my patients are established, and of course there needs to be a reason for encounter, and this is defaulted to yes. You wouldn't want to change this. Essentially, it's just a reminder that you do need a reason for an encounter for this type of encounter. And you can select back or cancel if you want to get out of this. On the next one, it's going to ask you for the history of present illness. Selecting this drop-down will tell you that there's either 1 to 3 brief, 4+ extended, or no value. If you have some thoughts about how to get those numbers, essentially you just look and see that you need to select the level from the pop-up based on how many of the following items apply: location, severity, timing, etc. And if there are 3 or more chronic and or inactive conditions, you would mark 4+. So in this case, because my patient has 4+, I'm going to go ahead and select that. For the review of systems, you have a similar pop-up that tells you how many systems you're going to look at. And for a reminder of what those systems are, you can go into the help screens and it'll tell you all the different areas. So to get 10+, you would have to go through 10 of those different areas. The next part is the history, and you simply select how many of the elements of the history you completed, and those are of course based on past history, family history, and social history. If all 3 are done, you would have 2 to 3, and this would be considered a complete history. On the physical exam section, this is one that sometimes is a little bit difficult. If it's 1 to 5 items, problem focused, at least 6 expanded, 2 from 6, or 12 from 2. I'll explain this in a minute. Once you get used to these, though, it's pretty easy to select. Essentially, what you're doing is you're going through based on extended problem focus being at least 6 bulleted elements, detail being at least 2 bullets from 6 organ systems, or 12 bullets from 2 or more organ systems. And then the comprehensive is 2 bullets from each of 9 organ systems, or all bullets from 9 systems. How do you know what those systems are? Here they are. It gives you the different systems and the bullets for each of them so that you can go through and make sure that you're getting all of these bullets correct. Most of us have these memorized over time, but if it's something you need to refresh your memory on, you can do that. I'm going to go ahead and select the comprehensive and then go forward with the number of diagnoses. Number of diagnoses is once again based on a scoring system, so you can get 1 point each for self-limited or minor, 1 point for an established problem, and so on. And you select the points based on this. If it's a new problem with additional workup, you can select 4 points, and in this case, that's what I'm going to do. On the following screen, amount and complexity of data reviewed. To review that, you can see how many points are given for each of the various elements. And in this case, I'm going to say nothing because I didn't review anything. And then finally, the level of risk. Most coding programs just have minimal, low, moderate, and high, but ours actually tells you exactly how to pick those and gives you a chart based on whether the presenting problem is 1, self-limited or minor problem. It would be minimal. Low would give you 2 or more, etc., all the way up to high, which would be a chronic illness with severe exacerbation, or if you were if your management option was high in the sense of you were recommending them for surgery, or if it was moderate, let's say something like elective major surgery or prescription drug management, which is something that we most of the time are doing, and many people forget to cover for that. So I'm going to say moderate based on the fact that I prescribed some. At the end of this, you can generate a coding. As you can see, this is a 99215, probably based on the fact that it was an established office visit and it had 2 components that were listed as comprehensive. But you can go through multiple different scenarios, and you can also just select this. I can just cancel this as a run-through, as I have done.